Hello everyone and welcome to today's session. Today we are going to talk about a very common topic which most of you actually suffer at some or the other point of time in life, but you may not be able to understand what exactly needs to be done about it. So today we are going to talk about swelling in our body, okay, which could happen, which could be in any part of the body, in any area of the body, and how does it affect us, and when is the right time to uh, get serious about it, show it to a doctor, or probably do some sort of therapy in order to get rid of the swelling. A lot of times I've seen that people just it just doesn't matter even if they have swelling in a certain areas of the body, or which is probably even chronic, but it doesn't matter because they just live with it and they feel it's absolutely okay. So this is where I want to let you know that it's a very difficult position, and what all are we going to cover in this session is basically different kinds of swelling, the reasons for the kind of swelling that we have in our body, and when is the right time to see a doctor, and what are the different foods or probably habits that can help us to prevent this kind of swelling. So before that, before we get on to the topic, thank you everyone for joining in. If you're watching us on Instagram or YouTube or on our Facebook page, thank you Kailash, Hasija, thank you Hitesh Badra for joining in, and you can put in your questions. Definitely I will be answering your questions at the end of this session. If you have any doubts, irrespective of the topic, if you have any doubts about any other issues related to your neck, shoulder, back, you can certainly put in your questions. So talking about our topic for today, which is swelling. Well, swelling is nothing but these tiny blood vessels which actually leak fluid into different areas. Now for example, if there is a swelling in your feet, it simply means that the blood vessels which supply blood to your foot area, they are leaking up a little bit of fluid, and this fluid is basically accumulating in the area of the leg. Now you can have different areas or different organs which can actually end up swelling, but most commonly what you see is your ankle and feet, which tends to swollen up. Typically we also see that swelling can happen because of any injury. Let's say if you have an injury to your ankle or if you have an injury to your hand, swelling is one of the signs of inflammation, which means that if there is any injury in your body, it will swelling is one of the signs that it will show. And this is the reason where we should not really ignore swelling. Whenever we have a swelling in our body, we should understand the cause of it. What could be the reason for this kind of swelling to happen, because it clearly means that there is some sort of injury in your body and it needs to be. So that's where we talk about different reasons where we can have swelling. Now, swelling that can happen because of a simple injury is essentially a acute kind of swelling, which as the injury phases out, as the injury starts recovering, you can see the swelling going down. You can see positive signs that are happening in the body, because of which you will see that the swelling is relatively settling down a bit, which is a very good sign. But there are swellings which sustain for more than 2 to 3 weeks, or at times there are swellings in the body which are sustained in specifically in the feet and ankle for a very longer time, and we start living with it. We start living with these problems that are related to the swelling, and that is where you actually need to consult a doctor. That is where you need to understand what exactly could be the reasons for your swelling. You may be very surprised to know, but these kind of chronic swellings essentially are one of the most important presentations in case of a kidney failure, in case of liver issues. It can even be one of the reasons for a heart failure on the right side. So these are different reasons for which you may be carrying that swelling in your body, and it's very important to understand the reasons, or rather understand the exact cause of which it happens. Again, one more important cause of chronic swelling could be emotional stress. Emotional stress can also lead to swelling, which can be specifically in your organs like liver, or even different areas of the body where your kidneys may not function in the right way, because of which you will see swelling typically in your feet and ankle. And most importantly, we tend to recognize these swellings only when we see them in the feet and ankle. The reason is that because you have a swelling in a dependent joint, because you're sitting, because you're standing most of the time, and your ankle is always placed onto the ground, so all the fluid gravitates to the ground, and that's why you can see that swelling more often present in the feet and ankle area, whether it is a chronic issue or sometimes even when it is an acute issue. We have seen a lot of people who travel, who are traveling by flight or who are traveling by any other means for a very long time. They tend to get these swelling, which is very very common. But yes, this swelling, it eventually goes off over a period of time. So it's not a chronic swelling, it's just swelling which is sustained for some span of time. So what exactly happens if we leave the swelling untreated, or if we don't do anything about it? First thing what you would see is restriction in the range of your motion. You will see that if, let's say, if your hand is swollen, you will see that your movement of your hand is becoming a little difficult. You can see that you're not very comfortable using the hand. Same thing happens with your ankle or even your feet. You will see that there is a restriction in the movement of this particular joint. Besides that, you can also see difficulty in walking. At times there can also be formation of ulcers or a reduced amount of blood circulation in specific areas wherever we see the swelling. Thank you. I think we have a lot of people joining in. Hi John, hi Abhishek, hi Sanchitamani, hi Amit Rocks, hi Mahesh Gide, Marketing Gunda 6995. Thank you everyone for joining in. So we were talking about swelling, the causes of swelling, what happens if a swelling is untreated, and now I'm going to tell you how do you really take care of your swelling, how do you really ensure that you can actually get it treated, or what are the measures that you can take in order to reduce your swelling. So one formula that works most of the time for all kind of swelling is basically called the Price formula, which is basically you start off with protection of the area which is swollen actually. So you just ensure that you protect that particular area, whether it is a shoulder, whether it is a hand, whether it is an ankle, you just protect that area. Second thing is you need to rest that area. The more rest you're giving to that area, the more swelling will drain down from that particular place. Third thing is doing icing therapy to it, basically using a few cubes of ice, placing it around a towel, and using it to the swollen area, which could be a shoulder, which could be a hand, whatever it is. So you can actually do icing to that area, and also trying to do a little bit of compression to this whole area. So compression can be done by simply tying up a bandage where you don't really prevent the circulation, but it is tied in such a way that it helps to reduce this swelling. And then ultimately elevation is very important. Positioning of that specific limb, whether it is a leg, whether it is a hand, is very important, and it should be above the heart level. So for example, if you have a swelling in the feet area, and if you lie down, you should probably have 3 to 4 pillows which should be kept under the feet, so that your feet is above the heart level. Only when your feet is above the heart level, it can actually help to reduce that kind of swelling. So this is where elevation plays a very important role. You may be surprised to know that food plays a very important role when it comes to swelling, and chronic swelling is essentially seen with people who consume high amount of salts. So you should reduce your intake of salt, have a good amount of water. You should also have potassium and magnesium rich foods, like you can have spinach, you can have avocados, you can have broccoli, you can also have bananas. All these foods are good, and it helps to reduce even chronic swelling. So you should certainly look at having these kind of foods on a regular basis. What exactly can help you to reduce? What are the natural reasons which can actually help to reduce your swelling? Hi, we have some more people joining in. So let me just acknowledge all of them. Hi, Vaibhav Raje, Fatima Punjani, Sanyog, Chitra Guide, Nagina Hassan, Reenak. Hi Reenak, how are you? Devish Shalal. Thank you everyone for joining in. Today we are talking about swelling. We are talking about the causes of swelling, what increases, what is exactly chronic swelling, when you need to see a doctor, and what are the normal natural ways in which you can try and reduce your swelling. So I was talking to you about the importance of diet when it comes to how we can look at reducing the swelling, reducing the amount of swelling. So yes, having good amount of water is a very important aspect. At least 8 to 10 glass of water on a daily basis is what you should have. At times when you are dehydrated, you tend to develop swelling in your feet and ankle areas, because body tries to retain a lot of water. A lot of people have these water retention issues, and they feel that this kind of swelling, what exactly needs to be done for this. Now here you need to consult a doctor, understand if any medication is required in this process, follow the price method, where you do a protection, where you do rest, where you do icing, where you do compression, where you do elevation. All these things should be done properly. There may be some medications that need to be given in the beginning, like diuretics, in order to ensure that the kind of swelling which is already there in the body can be removed gradually. And yes, having proper food and the right kind of diet, magnesium and potassium rich diet, like I told you, cashews, avocados, broccolis, all these things are pretty good. Bananas, they're all very good when it comes to trying to reduce your swelling. Intake of vitamin B6 is also helpful when we can think about reducing swelling. So this presentation is all about why you should not take your swelling lightly, because chronic swelling is something which is there for more than 2 to 3 weeks, and this kind of swelling can be a indication of kidney issue. It can be an indication of a liver problem. It can even be an indication of a right sided heart failure. So all these things have to be addressed immediately and understood the reason behind it, start some medications, and make sure that you take care of it in the right time. Okay, so we have some more people joining in. Hi Raj, hi Kishore Matre, IAMCP, Kirtan Parmar, Sanjeet Kumar. Thank you everyone for joining in. And this is all about we had in this presentation for talking about swelling. If you want me to discuss about a certain topic, do put in your comments. And if you have any questions, I am all the more happy to answer any of your questions if you have. And yes. So I had a question. I had put up a post regarding my live session, and I had a question regarding shoulder. There was a question about how can we get our shoulder treated. So treatment of shoulder depends. Treatment of shoulder essentially is because of pain in the shoulder, or it could also be because of you have limitation in the restricted, or there is a range restriction. Well, there could be a few reasons to it. Now we need to understand if there is a immediate muscle injury, which could be a rotator cuff injury, which is very common, happens to people who are into regular activities, or probably playing on a regular basis. And if this is continued for a very long time, like you just allow that pain to not to subside, or probably just live with it for a long time, eventually you start restricting the movement of your shoulder. Eventually you start avoiding any reach out activities where your shoulder range has to go absolutely normal. So you avoid these kind of activities, and that leads to the beginning of frozen shoulder. So any injury in the shoulder, and if it is sustained for a very long time, when it leads to restriction in the shoulder range, it can cause a frozen shoulder, and that is where you need to get it treated. Body manipulation works wonders when it comes to shoulder improvement in terms of their range, as well as reducing the swelling. There are certain stretches and exercises that needs to be followed. Once you have started your physiotherapy and you feel better with your pain, yes, these things definitely help out. So I have a question from Osam Court. He says, hi, can anterior pelvic tilt be treated with chiropractic session? Well, anterior pelvic tilt, yes, it can be treated, followed by a certain level of exercises also, which is required, because anterior pelvic tilt is not just a specific movement, and only one chiropractor session is not enough. Once you start doing these chiropractor sessions, you also need to strengthen your muscles. You also need to ensure that a proper strengthening is required in order to improve that anterior pelvic tilt, work on the compensatory muscles which have not been firing at all, and ensure that you build up your posture in the right way. And for all these things to happen, it's very important that certain exercises are followed on a regular basis. You can actually refer to my YouTube channel. You can type joints in motion or Dr Sudarshan Singh to check out my YouTube channel, where I have a playlist on physiotherapy exercises, where I have mentioned about different exercises related to different problems, whether it is a neck pain, whether it is a back pain, whether it is a shoulder pain. We have definitely given exercises to all these kind of issues, and you can actually refer to these exercises. Bailey Mercury has a question. I have a curved back and my posture looks bad. It was good earlier. It has changed due to lockdown. What can you recommend? Be like Mercury, there are definitely certain exercises that can help you to improve your posture. Spinal manipulation in the beginning will ensure that you have a correct posture, because normally it's not lockdown that is actually causing your posture to go bad, but your ability to move lesser is causing the posture to go bad. So definitely you can check this out. Spinal manipulation will work. Since it is a temporary condition, it is good that you can address it as soon as possible, followed by corrective exercises, and it will certainly help. Thank you so much for joining in. Thank you, Osam Court, and thank you everyone for your questions. So this was our session about swelling and what exactly needs to be done in case of swelling. If you have any questions, or if you want me to put up any topic, do put in your comments here. I'll be more than happy. Yes, it happens. Be like Mercury. Yes, it happens because of sitting in a specific position for a very long time. You can actually check my video on YouTube on neck and back pain. Probably it can help you to at least start off with some basic stretches, and whenever possible you can definitely visit me. Thank you so much for joining in, everyone, and following this session. And we will meet up next Friday once again at 10:30 and have our live session. Till then, take care, stay home, stay safe, healthy. Thank you.